Hi, this is Sharon Sutherland, and I just wanted to have a quick chat with you today about something that's very important to me, and that is the topic of the life box. This is something that I tell everybody when I'm doing clinical practice as well as when I'm teaching classes. I tell people, it's really important that we understand the life box, and I tell people I made it up. And the reason I say that is because it's a visual tool that I use every single day in clinical practice, and I sincerely hope that perhaps it can help you. So, what am I talking about? Well, can you find these 4 points? So, whether you're a person sitting in a wheelchair, whether you're a person sitting in a regular chair, whether you're a therapist trying to figure out somebody's postural alignment for seating, perhaps, or how it compares to lying down, there's so many applications for this. So whoever you are, can you find these 4 points? And what I'm looking at is underneath the inferior angle of the ribs and the front of your pelvis, or the ASISs, those two bony prominences on front of the pelvis right here and right here. The anterior superior iliac spines, or as we often call them in clinical practice in a shortened version, ASISs. So what you're looking for are those 4 points. So why do I call this the life box? I call it the life box because there's so many important things between those 4 points, inside those 4 points. So when you think about it, the consequences of squishing the contents inside these 4 points can be manifested in respiratory dysfunction or challenges with respiration. With digestion, we can have also complaints about constipation or firmness or distension in the abdominal area. We might have some circulatory challenges. We certainly could have some skin integrity challenges, and what often goes unspoken about, especially for those clients or persons that we work with who can't communicate this with us directly, is the pain and discomfort. And unfortunately, this pain becomes a norm for a lot of the persons we serve, and therefore it may not even be identified as pain. I've often seen people in clinical practice where their posture was not described as one of complexity, one with complexity. But when soon as you lift up their shirt and palpate those 4 points between the ribs and the pelvis, it's amazing the different shapes and ways we find that relationship. I think it's critical that as clinicians, and as well as anybody taking care of another person who perhaps has got some limited mobility and who spends more time sitting perhaps, that I think it's critical that we understand the reason why an individual presents like this, and especially if we're going to make a difference in their postural care. So when you look at these little pictures, you can see these are x-rays. This is just an example of sometimes how so much shape distortion can happen in a person's body. And there's also a big difference between this relationship when somebody's sitting versus lying. And that's when it really becomes a red flag for me. So are any of these relationships familiar to you? These are pictures I just took of my daughter this morning. Thank you, Charlie. And looking at the relationship between the ribs and the pelvis. So palpating the inferior angle of the ribs, palpating the ASISs, and I just put lines in to kind of highlight that relationship. So this is a very nice, open relationship. With ability, with good opportunity for respiratory function, digestion, etc. Now, this is more of a slumped position. So when we fall into a posterior pelvic tilt and a consequential kyphotic posture, for example, so maybe it could be something as simple as we're sitting on a chair in everyday life that doesn't give us enough support. So we collapse when we fatigue. Or maybe we're working with a client, a person who sits in a wheelchair, and they may not have a good back support behind them. They may not have a good cushion. They may not have the appropriate support. So therefore, they're only making contact with the middle of their apex of their spinous processes. But on the front part, when you palpate between the ribs and the pelvis, and you have to actually palpate because you could guess, but guessing is never good enough when it comes to somebody's postural care. So on palpation, you can feel quite easily the inferior angle of the ribs and the pelvis. Some other examples. This is where you might often see somebody sitting with a more triangular relationship. We might look at this person and say, well, they've got a pelvic obliquity. And that's good. That's step one. Checking the life box and then checking the pelvic alignment. We can say that this person has got a left pelvic obliquity. That's the correct language. Left pelvic obliquity, which means the left side is low. But that doesn't tell us anything about the why. It just says this person presents with a left pelvic obliquity. It doesn't tell us anything useful other than it is what it is. Then we have to find out why. And here's another example. So this is an example of somebody presenting with perhaps some rotational components as well. So the consequences for the relationship between the pelvis and ribs can be extremely difficult for this person who's sitting. In respiratory function, digestion, circulation, skin integrity, and pain and discomfort, to name a few. How do we find the answers to this? How do we know when we look at somebody's ribs and pelvis, how do we actually know the why? Why is somebody presenting like this? We can guess all day long, but for me personally, as a physiotherapist who has specialized in this field for the last 32 years, the only way I can find the answers every day is through doing a full, thorough, hands-on assessment. And today I just wanted to touch on the life box, a full thorough assessment. For example, I might look at it in the existing seat, check the life box. In the existing seat, check for pelvic alignment. In the existing seat, examine the sitting footprint, another topic I'll talk about another day. And in the imagine, for example, if we lay in the snow and made snow angels, or if we lay in the sand, which is probably my preference, we can see our body shape when we stand up. Well, sitting it's my visual imagination, again, looking at the sitting footprint. Some people use pressure mapping for that. And you can also use pressure mapping, but I just want to give you a visualization. And then we get onto a firm, flat surface and we do the supine assessment, just lying down. And that is honestly where all the facts can be found, or the majority of the facts can be found. In the absence of this thorough examination, we often will never know why a person's life box is not optimally aligned and therefore preserving all of their internal physiological functions, for example. And once we do the supine assessment, and that's another day as well, then we can look at the sitting simulation relative to the findings from the supine assessment. And then, of course, very, very important, we have to make sure the person can function in whatever seated simulation that's created. So thank you for your time. I just wanted to have a quick little chat with you today and to talk about the life box. Have a lovely day, and I'll be back with another topic another day. Thank you.